OCD by Brittany Hahn. Overview. What is obsessive-compulsive disorder? OCD. Obsessive-compulsive disorder, OCD, is a disorder in which a person has uncontrollable, reoccurring, unwanted thoughts, ideas, or sensations known as obsessions, and/or behaviors known as compulsions that they feel the urge to repeat over and over. Not performing these behaviors commonly causes great distress and anxiety. By performing compulsive acts, an individual with OCD believes they will ease their stress. Despite their efforts to ignore or ease these bothersome thoughts and urges, their obsessions keep coming back. This only leads to more ritualistic behavior and compulsions, trapping the individual within the vicious cycle of OCD. Many people with OCD know or suspect their obsessions are not realistic, while others may think and believe they are true, known as limited insight. Even if they know their obsessions are not real, people with OCD have great difficulty disengaging from their obsessive thoughts or stopping their compulsive actions. OCD often centers around certain themes. For example, an excessive fear of getting contaminated by germs. To ease this fear, an individual may compulsively wash their hands to the extent that they become sore, chapped, and bloody. To be diagnosed with OCD, an individual requires the presence of obsessions and/or compulsions that are time-consuming, taking up more than 1 hour of their day, cause significant distress, and impair their work or social functioning. Signs and symptoms. An individual with OCD will display symptoms in the form of obsessions and/or compulsions. Usually, an individual will have both obsessions and compulsions, but it is also possible to have only obsession symptoms or only compulsion symptoms. An individual may or may not realize that their obsessions and/or compulsions are excessive or unreasonable, but despite this, these obsessions/compulsions take up a great deal of time and will interfere with the individual's daily routine and social, school, or work functioning. Let's look at what obsessions and compulsions are more in depth. Obsessions. Obsessions are recurrent and persistent, unwanted thoughts, impulses, urges, or mental images that cause distressing emotions such as anxiety or disgust. Many people with OCD recognize that their thoughts, impulses, or mental images are a product of their mind and that they are excessive or unreasonable. However, the distress caused by these intrusive thoughts cannot be resolved by logic or reasoning. Most people with OCD will try to ease the distress caused by their obsessions by performing compulsive behaviors or rituals. Typically, obsessions will intrude on an individual's mind when they are trying to think or do other things. Common obsessions include, but are not limited to, fear of germs or contamination, unwanted, forbidden, or taboo thoughts involving sex, religion, or harm, aggressive thoughts towards others or yourself, extreme concern with order, symmetry, or precision, recurrent intrusive thoughts of sounds, images, words, or numbers, fear of losing or discarding something important, fear of blurting out obscenities or insults. Compulsions. Compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession. These repetitive behaviors or mental acts are meant to reduce anxiety caused by an individual's obsessions or are performed under the belief that they will prevent something bad from happening to them. However, engaging in one's compulsions brings them no pleasure and may offer only temporary relief from their anxieties. An individual may make up rules or rituals to follow that help them to control their anxiety while having obsessive thoughts. These compulsions are excessive and often are not realistically related to the problem they are intended to fix. Constant repetition of rituals may fill an individual's day, making a normal routine impossible and disrupting their lives. Common compulsions include, but are not limited to, excessive or ritualized hand washing, showering, brushing teeth, or toileting, repeated cleaning of household objects, ordering or arranging things in a particular way, repeatedly checking locks, switches, or appliances, constantly seeking approval or reassurance, repeated counting to a certain number, following a strict routine. Some individuals with OCD also have a tic disorder. Motor tics are sudden, brief, repetitive movements, such as eye blinking and other eye movements, facial grimacing, shoulder shrugging, and head or shoulder jerking. Common vocal tics include repetitive throat clearing, sniffing, or grunting sounds. Causes or risk factors. While the cause of OCD is unknown, the National Institute of Mental Health notes that risk factors include genetics. Twin and family studies have shown that people with first-degree relatives, such as a parent, sibling, or child who have OCD are at a higher risk for developing OCD themselves. The risk is higher if the first-degree relative developed OCD as a child or teen. Ongoing research continues to explore the connection between genetics and OCD and may help improve OCD diagnosis and treatment. Brain structure and functioning. Imaging studies have shown differences in the frontal cortex and subcortical structures of the brain in patients with OCD. There appears to be a connection between the OCD symptoms and abnormalities in certain areas of the brain, but that connection is not clear. Research is still underway. Understanding the causes will help determine specific, personalized treatments to treat OCD. Environment. An association between childhood trauma and obsessive-compulsive symptoms has been reported in some studies. More research is needed to understand this relationship better. In some cases, children may develop OCD or OCD symptoms following a streptococcal infection. This is called pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, PANDAS. Prevalence. OCD is a common disorder that affects 2 through 3% of people in the United States. Among adults, slightly more women than men have OCD. OCD affects adults, adolescents, and children all over the world. Usually, OCD begins in individuals when they are in their teens or young adult years. Typically, OCD will onset at an earlier age in boys than in girls. According to Mayo Clinic staff, symptoms usually begin gradually and tend to vary in severity throughout life. The types of obsessions and compulsions you experience can also change over time. Symptoms generally worsen when you experience greater stress. OCD, usually considered a lifelong disorder, can have mild to moderate symptoms, or be so severe and time-consuming that it becomes disabling. Treatments and therapies. According to the National Institute of Mental Health, OCD is typically treated with medication, psychotherapy, or a combination of the two. Although most patients with OCD respond to treatment, some patients continue to experience symptoms. Medication. Serotonin reuptake inhibitors, SRIs, which include selective serotonin reuptake inhibitors, SSRIs, are used to help reduce OCD symptoms. SRIs often require higher daily doses in the treatment of OCD than of depression and may take 8 to 12 weeks to start working, but some patients experience more rapid improvement. If symptoms do not improve with these types of medications, research shows that some patients may respond well to an antipsychotic medication. Although research shows that an antipsychotic medication may help manage symptoms for people who have both OCD and tic disorder, research on the effectiveness of antipsychotics to treat OCD is mixed. Psychotherapy. Psychotherapy can be an effective treatment for adults and children with OCD. Research shows that certain types of psychotherapy, including cognitive behavior therapy, CBT, and other related therapies, example, habit reversal training, can be as effective as medication for many individuals. Research also shows that a type of CBT called exposure and response prevention, EX/RP, spending time in the very situation that triggers compulsions, example, touching dirty objects, but then being prevented from undertaking the usual resulting compulsion, example, hand washing, is effective in reducing compulsive behaviors in OCD, even in people who did not respond well to SRI medication. As with most mental disorders, treatment is usually personalized and might begin with either medication or psychotherapy, or with a combination of both. For many patients, EX/RP is the add-on treatment of choice when SRIs or SSRIs medication does not effectively treat OCD symptoms, or vice versa, for individuals who begin treatment with psychotherapy. Other treatment options. In 2018, the FDA approved transcranial magnetic stimulation, TMS, as an adjunct in the treatment of OCD in adults. NIMH is supporting research into other new treatment approaches for people whose OCD does not respond well to the usual therapies. These new approaches include combination and add-on augmentation treatments, as well as novel techniques such as deep brain stimulation. The American Psychiatric Association also notes that self-care, such as maintaining a healthy lifestyle, can help in coping with OCD. They recommend using things like basic relaxation techniques, such as meditation, yoga, visualization, and massage to help ease the stress and anxiety caused by OCD. While there is no way to prevent obsessive-compulsive disorder, Mayo Clinic staff suggests getting treatment as soon as possible, as it may help to prevent OCD from worsening and disrupting activities and your daily routine. Impact of disorder on relationships. When an individual suffers from OCD, their personal life is impacted negatively in many ways. Interacting with others and performing work or any daily task becomes a struggle, as their life is constantly disrupted by their obsessions and compulsions. It is for this reason that OCD comes bundled with other disorders, such as anxiety or depression. Individuals with OCD are constantly suffering from the stress and anxiety of their anticipated and looming obsessions/compulsions. Living in the shadow of these obsessions/compulsions drains the happiness of life away from them, leaving them at the mercy of their depression. Living in a constant state of anxiety and depression along with their OCD, individuals feel as though they have no life at all. This feeling can lead people suffering from OCD to become suicidal or inflict self-harm, as they believe it is the only way out, the only way to escape the vicious cycle. With this being said, it is important for people suffering from OCD to seek help right away. No obsession and/or compulsion is too small, silly, or invalid. Every obsession and/or compulsion matters. Help should always be sought out. Personal connection. OCD seems to run in my family. My father, brothers, and sister all have OCD, along with many of my relatives. Thanks for watching.